So when it comes to young people, and I'm guessing that a lot of you in the room are youth workers, is that correct? Most be youth workers, yep. Or you're working with young people in clinical roles as well, some health professionals in the room. And I bet if we went around the room and asked everybody, what's the most challenging sexual health question a young person has asked you, there'd be some absolute doozies that came out. Young people like to ask questions, okay? They ask questions as a way to test us out. That's where the challenging questions will sometimes come into it. How far can I push this worker, or how far can I push my parent or carer? How much is it that they're going to be willing to tell me, okay? So when these challenging questions come up, it's really important the way that we react. And you think about, even as an adult, if you go to a health professional or you go to somebody who you trust and respect and ask a question, most of their response isn't about the words that are coming out of their mouth, is it? It's about their body language and how they've responded to the question that you've asked. So when a young person asks us questions around sexual health related topics, we really need to be unshockable, okay? Or be really mindful of what our reactions are at the time. So if somebody comes to you, for example, and says, I think I might be gay, would I know that by the time I'm 15? And you're like, huh? That's not going to be a positive response for that young person, as opposed to being really neutral, like, hey, thanks for coming to me with that. That's great that you trust me. Like, sexuality is something that's fluid across your life. You may feel like you're attracted to the same sex now. You may always be attracted to the same sex. That may change, and whatever it is, that's okay. Feel free to keep coming to me and having those conversations. You can see the difference in response and how that young person may be feeling after getting those two different responses. So be unshockable, be prepared for these questions, and be really mindful of your expressions and your reactions. Another thing that we recommend is staying curious. So the game's changed a lot. I am moving on in my own years, and I'm seeing young people now, and the game's very different to what it was when I was 16, and I can imagine that game's incredibly different to when my mother and my grandmother were 16. So times are always changing. We need to keep up to date with the information that's coming out and what young people are exposed to. So stay curious. When it comes to sexual health, we can quite often get locked because of our own thoughts and feelings or our own values and beliefs around sexuality and sexual health. We can sometimes get blocked into thinking black and white. It's my way or no way, okay? But when it comes to dealing with young people in sexual health, we need to be open-minded. We need to stay curious. Shift away from that thinking of black and white, right or wrong. Because sexual health is everybody's journey. No two people share the same story when it comes to sexual health. So a really favourite quote of mine is, it's not wrong, it's just different. So because somebody might have different interests or do things differently to me, it doesn't make what they're doing wrong, it just makes it different. And it will put your conversations in a far more positive place if you have that mindset and you're thinking that way. Okay. Is there any questions on that? Show of hands if you've had a tricky sexual health question thrown your way before. Yeah, they're out there. They are out there. I guess the point to make with the challenging questions and people asking information too is that it's okay for us to not have the answers, okay? It's okay for us to go, you know what? I don't know the answer to that, but hey, what a great opportunity for us to find out together. And you can use some of the resources that we mentioned at the end to get that information. The most important thing is that you're being honest with the young person. Honesty is everything. So we're talking about that relationship of trust and rapport. If we're not being honest, are they going to trust us to come back and speak to us about these things again? Not likely. So honesty is the best policy.